Generally, as of now, the second week in July, we recommend collecting 2 swabs from at least 2 different locations on the body or from lesions that differ in appearance. So that means collecting at least 4 swabs from a single patient and maybe more. If you're confused about which swab to use, I recommend clinicians use the same swab that is used to test someone for COVID-19. The swabs are a dry swab, and for this reason, lesions should be swabbed vigorously to make sure enough DNA is collected.
We're really working to increase the availability of doctors to access testing. Just want to say commercial laboratory testing is now available at several major laboratories. And we're encouraging broader testing of patients who present with lesions or other symptoms that might suggest they should be suspected for monkeypox.
Interestingly, Todd, during this outbreak, some patients are presenting with a rash before the other associated symptoms. And contrary to the characteristic rash I just described, some patients have lesions isolated to the genitals or anus, and some might have very few lesions that might initially be confused with pimples, ingrown hairs, or blisters. For this reason, clinicians should perform a thorough skin exam, including of oral, anal, or vaginal mucosa, to look for skin lesions or rash that might be consistent with monkeypox. And another important consideration is that co-infection has been reported with monkeypox and other infectious agents that can cause a rash, which include sexually transmitted infections or STIs. So the diagnosis of an STI does not exclude monkeypox, as a concurrent infection may be present. And we know that the clinical presentation of monkeypox may be similar to that of STIs like syphilis, herpes, lymphogranuloma, venereum, or other etiologies of proctitis. So for this reason, in people with epidemiologic risk factors, rashes initially considered characteristic of more common infections should be carefully evaluated for signs and symptoms consistent with monkeypox.
What's the CDC doing to make testing more accessible? And what do physicians and patients need to know about testing for monkeypox?
Thank you so much for that question. It is a really important issue, and I think CDC is working hard to try to make it be more accessible. The important thing is an untested monkeypox patient is an uncounted monkeypox patient and is someone who might be out there continuing to spread the virus. So we definitely think that testing is one of the important cornerstones of our response. We're working to increase awareness of testing capacity. We're working to try to ease the access issue so that we can then get more people tested and then better understand how and why monkeypox is spreading in the United States. So to raise awareness through clinician education with our Health Alert Network notices, or HANs, and several COCA calls that we've put out information about clinical presentation, patient management, post-exposure prophylaxis, treatment options, and how to test. So information about how to test is available in those clinician resources. Results from early testing are so important because it helps healthcare providers advise their patients about the steps they need to take to prevent further spread. And health officials can obtain information about people with whom the patient has had recent close contact with once testing is part of that equation. So it's really important.